I started performing radiofrequency ablation back in 2011 when I was still a resident with Professor Luigi Solbiati, that was my mentor. And since then I've used this technology for the treatment of benign and malignant lesions up to now. Patient selection is absolutely key for the success of the procedure. We have to separate benign conditions from malignant conditions. In benign, the selection is based mainly on the presence of symptoms, so the patients need to have symptoms, compressive symptoms, or cosmetic concerns, and or hyperfunctioning nodule, for example. Sometimes also patients with growing nodules where we expect symptoms to occur. In that case, we can consider ablation also. Patients of quality of life is absolutely the most important aspects when we deal with benign thyroid nodules, because we treat them only because of their symptoms. So we also always look for the aesthetic aspect of the patient with the scoring system that goes from 1 to 4, and for their own perception of feeling with a visual analog scale that is going from 1 to 10, and we follow the patient and look for the improvement in their symptoms and in their quality of life. Luckily, complications after radiofrequency ablation are very uncommon and quite rare. Still, it is very important to manage that promptly and properly. For that reason, I think the key is to have the contact of the patient, and the patient should be able to contact his physician easily in order to report immediately any kind of complications. That is the most important thing, to be able to intervene rapidly in case of any complication. There are a lot of clinical trials out there, so I want to share some personal experience, particularly in the treatment of malignant thyroid tumor and papillary thyroid microcarcinomas. In that scenario, I had great satisfaction because also quite unexpectedly, the patients are very happy of that treatment. Often patients have been suggested to undergo only active surveillance or only surgery as potential alternative treatment, and when I propose thermal ablation, patients are really satisfied. So that is again a key issue for application of radiofrequency ablation, particularly in papillary thyroid microcarcinomas. When I started doing ablations that were mainly reserved for patients not suitable for surgery or really refusing surgery, it took me a lot of efforts in Italy and in Europe to expand this technology and to make it, as it is now, a first choice option for patients. So nowadays, after a long period and a lot of work, patient can be proposed with thyroid ablation as a first choice option for benign symptomatic thyroid nodules and also for papillary microcarcinomas. And that is one of my greatest satisfaction deriving from my work.